We now know that the number of Americans who've signed up for private insurance in the marketplaces has grown to 8 million people. 8 million people. 35% of people who enrolled through the federal marketplace are under the age of 35. All told, independent experts now estimate that millions of Americans who were uninsured have gained coverage this year.
Top of the news may be dominated by Iraq, Bergdahl, and political upsets in Virginia, but that does not mean the interesting nightmare that is Obamacare should be allowed to simply vanish into thin air. There are those in the administration who will tout that the health care program is working in certain states and working beyond expectations. Then there's reality. Those states once enthusiastic about Obamacare are the ones having the greatest issues. And then there's this little matter of Medicare savings. Welcome back to MidPoint. Newsmax Deputy Health Editor Nick Tate joins us here in the studio. Nick, pleasure to see you again.
Good to be here, Ed.
Here we go. Some states had said, this is enthusiastic. We're it. We want to be here. Everything is working great. Yet there's a number of states that all of a sudden are having a little buyer's remorse, I think, in all this, aren't they?
There's kind of an irony here in that many of the states that said, yeah, bring it on. You know, we'll start our own exchanges. Massachusetts, Maryland, Nevada, Oregon, Washington. And now they're having extraordinary problems. In some cases, the exchanges there are being described as failures. I think the question here is, the issue here really is creating a new healthcare marketplace is a much more complicated and expensive process than I think anyone anticipated. And so, as we've said, the narrative on Obamacare has changed as we've moved from rhetoric to reality, and that reality in some of those states has been very tough.
Is it fair to say then that if just simply some other things had been done, a little time had been taken, let's look at the bright side of this, that this could have worked, not in the current form that it's in, but you just talked about a lot of things here that simply just weren't done for expediency or whatever purpose.
Well, you know, on paper, the idea of using the states as experimental laboratories and see what works is really a good idea. But of course, with the deadlines and the pressures and everything rolling out at the same time, with the technical problems we've seen with the sheer number of people signing up, it really has not allowed for any time to sit back and say, well, you know what? Kentucky actually did pretty well this year. They signed up, you know, 400,000 people. New York, California, Connecticut have had some pretty good success. If there's a way to take advantage of those benefits and say, what did they do right that we can apply in the other states, then that's a way to really address this. But that's not how this is moving forward. And the truth is, in at least 4 of those 5 states, the officials, where they've had problems, the officials are now talking about defaulting to the federal government and letting the federal government run those exchanges. And you know what the problems have been with the federally run health exchanges.
That's always a bad idea. Which states are those that really got it wrong? I mean, a couple of them. Give us an idea.
Well, Massachusetts, Maryland, Nevada, and Oregon, those are states where it took them days to get people signed up. There were technical glitches. Now at the front end, there were problems at the front end with getting people signed up. Now we're finding at the back end, some of those people who thought they had certain doctors don't have those doctors. People are finding out their networks are more narrow than they expected. And some folks are just having a hard time paying their premiums. And what's interesting to me is that those exchanges were created with hundreds of millions of dollars of federal funds. Now those states are going to have to figure out how to fund the next year without that federal largesse. And it's going to be, for I think consumers and for small businesses that are turning to these exchanges, I think we're looking at another year of what difficulty, to say the least.
Something else the administration does not want to talk about, obviously, because it's a failure. And I hear this from medical professionals I know, doctors, nurses, everybody involved. First of all, I hear there's not enough doctors. They don't know if there will be enough doctors down the road, and the wait times are getting ridiculous.
There's even a new study out today that looked at 15 individual metropolitan areas in the country and found that you can wait as many as 3 to 6 to 7 months if you're in Minneapolis, if you're in Seattle, if you're in San Diego to find a dermatologist, a cardiologist, or just a primary care doctor. We are already experiencing doctor shortages with the increase in the number of insured Americans that are going to be coming into the system in the next 2 to 3 years, and the number of doctors reaching retirement age and retiring, moving into concierge medicine, getting out of the practice entirely. I think we're going to find that those two colliding trend lines are going to lead to even more shortages, and that's a problem for consumers.
When they collide, now there's the thing. When they collide, what's the answer? I mean, it's inevitable. It's going to happen.
Right.
So, all right, we got to put a Band-Aid on this. What is that Band-Aid? Where does it start?
The answer is we need to provide more incentives for medical students to get into primary care. There's a further complication in that federal bureaucracy, red tape, places a cap on the number of residency programs. So you graduate from medical school. The irony is we're at record high levels of medical students who are graduating from medical school, but because there is a federal cap on the residency programs that allow those doctors to move from school to practice. They have to go to a 3 to 7 year training program called a residency program. In those cases, there's a cap on them, and so that's limiting the number of new doctors that are coming into the system. So we need to fix that. We also need to figure out a way to encourage people to get into primary medicine, which doesn't pay as well as specialty medicine. We also need to figure out a way to get those new doctors in those areas that are underserved and are mostly in need. One way to do that is to have the federal government help pay those students those medical school loans and get them to practice where they are most needed. So there's a couple solutions that...
None are easy.
No, none are easy, and in fact that's not a part of the whole Healthcare Reform Act. It's one of the missed opportunities, it seems to me, as we've rewritten the laws on the healthcare system. We've let this one problem go without a lot of focus.
Well, the way this is going right now, I may ask you to go ahead and write a prescription here in a couple of moments to go ahead and get out of things here the way allergies go and everything else. But a minute and a half or so that I have left here, I saw this. The Medicare reforms, they're really resulting in very little savings. People always thought there'd be some great savings here. What happened to that idea?
Well, the whole idea with Medicare was to create these new accountable care organizations that create teams that care for patients. Bundled payments are paid to doctors who work with specialists and hospitals and insurers. And the idea is if you work as a team, you provide better care, you hold down costs, and in fact bonuses are paid to those teams that deliver care under certain thresholds. But the early results on the Medicare ACO pilots is that they really don't save a whole lot of money. Now patients like them. The patient satisfaction surveys on the positive side, they seem to like the care that they're getting from their doctors and from their teams. But in terms of actual savings, they don't save a lot of money, and as we know, 10,000 Americans turn 65 every day and are going to do so for the next 9 years. Qualifying for Medicare, how we're going to fund that is an extraordinary problem, again, that we have not yet figured out, and this just speaks to it.
It's just the gift that keeps on giving, isn't it? I mean, every time we look, it seems to get worse, Nick. It doesn't seem to be any out on this whatsoever.
Well, look, I think the proponents argue that there have been some successes with Obamacare. People have signed up. There are some opportunities. People with pre-existing conditions can have an easier way of getting insurance. But the cost for those benefits, where the debate really comes in, is, are the benefits really equal to the cost? We're paying a lot of money, and there are a lot of problems that we're discovering as we move forward.
I promise you next time you come in, I'll be healthy. I'll try, I guarantee you.
I hope so.
Tell us what you think now about this on social media, because we answer your questions. First of all, Dr. Nick, thank you very much for coming in today. We appreciate that.
My pleasure.
Don't forget to get hold of us on Twitter, email, and Facebook. Let us know what your experiences have been. Has anybody had a positive one? That's really what we need to look for. We continue right here on MidPoint, where we do question everything.